hi to our lecturer and a very good teacher, our lecturer and all the classmates. Before we start, let us ask you some question, a simple question. Can you guess what the topic we will discuss about? It? Correct. Yes, our topic today is about drug abuser and addicts in Malaysia.
Assalamualaikum and a very good day to everyone. First, we would like to introduce ourselves. My name is Irdina Adini binti Anwar, and with me is
Siti Nur Atirah Biterangkai.
we are from class BE2493C. And today we will be presenting on a very important and serious issue, which is drug abuser and addicts in Malaysia. And we would like to present it to Madam Zarlina binti Muhammad Zamari. Moving on to the next slide where we will be talking about drug abuse. So what is drug abuse? Drug abuse is defined as the misuse or overuse of chemical-based substances. These include illegal drugs and legal drugs that are used for non-medical purpose. People usually start taking drugs because of peer pressure, family issues, stress, or emotional problems. So how does drug works in our body? When someone takes drugs, the chemical enter the bloodstreams and travel it to the brain. This affects emotions, actions, and how the person feel pleasure. Over time, the brain becomes dependent on the drugs, leading to addiction. So, in Malaysia, there's a few common drugs that are commonly used, which is heroin, morphine, and marijuana. There's also a few examples such as cocaine and inhales, such as glue. Drug abuse causes several serious effects on the society. It can break down families and causes emotional suffering, especially for the children. It also leads to major health problems, including the risk of disease such as HIV or AIDS. Addiction can also drive people to commit crimes such as robbery. And lastly, drug abuse often loses the focus and motivation, which reduce the productivity at work or school.
There are two main purposes of our presentation about drug abuser and addicts in Malaysia. First, to identify the trends and patterns of drug abuse cases from 2018 to 2024. The second thing is to analyze the difference in the drug abusers statistics between the gender males and females in Malaysia. The credibility from our presentation of this topic is all statistical data used in our chart was taken from the official website of the National Anti-Drugs Agency Malaysia, aka ADK. We also refer to supporting academic research to understand the causes and effects of drug abuse more deeply. This bar chart shows the total number of drugs abuse cases from the year 2018 until 2024. The trend shows fluctuating change over the year. In 2018, the total number of recorded cases was 160,788 cases, and these numbers increased in 2019 to 142,199 cases. However, in 2020, the number slightly decreased to 128,325 cases, before dropping again in 221 to the lowest recorded value of 123,139 cases. After 2021, the cases started rising again with 137,176 cases reported in 2022. The upward trend continued in 2023 with 145,522 cases, and the highest number of cases occurred in 2024, reaching 169,699 cases. Overall, the data shows a reduction in drug abuse cases between 219 and 221, followed by a consistent increase from 2020 to 2024.
Moving on to the second chart, the data presented in the bar chart show the number of drug abusers and addicts in Malaysia from 2018 to 2024, categorized by male and female cases over the 7 years. Based on the chart, we can see that the number of cases fluctuates throughout the year. However, one pattern remains very clear. Male cases are significantly higher than the female cases on every year. Now, let's look at the breakdown for the male cases. The highest number of male cases was recorded in 2024. The second highest was in 2023. The third highest occurred in 2019, while the middle range was recorded in 2022. The third lowest was in 2018. The second lowest was in 2020, and finally the lowest number case of the male category is in 2021. This overall trend shows fluctuations but a significant increase towards the 2023 to 2024. Now, next, we will look at the female cases. The highest numbers of female cases was in 2024. The second highest was in 2019. The third highest was in 2023, while the middle range was in 2020. The third lowest cases that are being recorded was in 2022. The second lowest was in 2018, and the lowest numbers of female cases was in 2021. Comparing to the males, the total number of female drug abusers is much smaller. Yet, the trend also shows slight fluctuation across the years. From the data, several important points can be highlighted, which is male cases consistently outnumber the female cases by a large margin. Both genders experienced their lowest cases in 2021, possibly due to movement restrictions during the pandemic. The year of 2024 recorded the highest number of cases for both genders.
This is the recommendation of our topic about drug abuser and addicts in Malaysia. And these are 5 effective ways to avoid drug abuse. First thing first, choose the right person or the right friends to be friends with you. And then stay busy with positive activities. And thirdly, seek guidance and support, and educate yourself about the dangers of drugs. And the lastly is to maintain a healthy lifestyle.
Now, moving on to the conclusion. In conclusion, our analysis clearly shows that drug abuse and addictions cases in Malaysia have continued to rise over the years, reaching their highest point in 2024. The data also reveal that male individuals make up the majority of drug abusers comparing to females. These trends highlights the urgent need for stronger preventive measures, effective rehabilitation program, and continuous public awareness campaigns. Thank you for your attention.
Bye.